go.
You guys know who this guy is, and if you don't, get over to Instagram right away. I was shocked to see him with a shirt on. Usually he doesn't. He's working out, and boy, if I look like that, I wouldn't even own a shirt. He's been on the show before. He's got his own shows. You need to go check this guy out. He's got a lot of stuff going on online. Look, I don't invite very many people over to the house, but he's been over to the house. He's that kind of guy. You just want to invite him over. I'm talking about Dr. Shawn Baker. Shawn, welcome to the show. I'm going to leave it to you.
Hey, Vinny, thank you so much for having me. It's an honor to be with you guys, with your audience, and then with all that great speakers that you had before and after me. So this is a real privilege. I'm going to talk about a little bit different stuff today. Well, I mean, it's still obviously, kind of stuff we're learning about the carnivore diet, but I'm not going to try to convince people, why you should do a carnivore diet or, what the rationale behind it. But it's more what we've kind of learned over the last couple of years as we get more and more data. So I'm going to share my screen now, just kind of get into this, and then I'll try to leave room for a lot of questions if possible. So let me just get back to the technology here. Click on share, and can you guys hopefully let me know if you can see my screen? Can you guys see my screen?
You can see it, Shawn.
Okay, so carnivore diet lessons learned from the field. So this is just some of the stuff we've learned over the last several years as I've been both a very vocal advocate and learning from research from other sources, and then of course the experiences of the community and myself. And so I do have some conflicts of interest. I'm the author of a book called The Carnivore Diet, which is pictured there. I'm the CEO of a company called MeatRx.com, which is a large community platform that is dedicated to helping people, improve their health using animal-based nutritions. And I am certainly a dedicated meat eater. So take everything I say with a grain of salt, because I am certainly conflicted, although I try to be truthful as much, that's my intention, to be truthful based on what I know. Okay, so where's the information I'm going to share with you coming from? There's some historic stuff. Obviously most people are aware of. There was a large year-long clinical trial back in 1928. Two people, one was a guy named Vilmar Stefansson and Karsten Anderson, were put in a metabolic ward for a period of time and then followed for a year, eating an all-meat diet, as they had claims that they had done so successfully after spending up to a dozen years in the Arctic with some of the Inuit populations. And the main nutritionists of the day didn't believe it was possible, and they basically came through that study. I think 6 highly published or popularized peer-reviewed studies were generated from that particular experience. We've got some isolated case reports and more recent literature. A group out of Hungary led by Doctors Csaba Tóth and Zsófia Clemens from the Paleomedicine have published a number of articles on carnivore diets. There are obviously historical populations observations we can kind of draw some of our conclusions upon. There are currently some studies in process, which is a new development. Belinda Lennertz and then David Ludwig. Belinda is a primary investigator. David's a senior investigator. Are looking at information from 2,000 people that have been on a carnivore diet for at least 6 months, doing an observational study. That is ongoing. The data collection period is over, and will be in the basically the getting written up and hopefully ready for publication later this year. And then we're trying to get a randomized control trial, intervention trial, which is currently in the funding and design stages. And thankfully, we've already we just launched that a week ago, and we've already raised something like $53,000 for that, trying to get to $200,000. So, and then I spent every single day, 7 days a week, basically since we launched this MeatRx, basically without a day off. I spend an hour with our community, and we constantly get feedback. We are constantly checking what is going on in the community, what people are trying, what things they're finding out, and we're starting to get some data that's converging on what things are working for what people and how to kind of tailor this diet based upon who you are, what your situation is. And so this is, I think, something that is important. There's not a just go do one thing and it works for everybody. So we're learning as we go. So what is the carnivore diet for those who don't know that? Well, first of all, I'm not very dogmatic, although there are people within the community that tend to do that, but it is not reverse veganism, okay? We are very much, or at least I am very much an advocate of doing what works best for you and not your ideology, okay? Some people include modest amounts of plants in their carnivore diet. Goodness gracious, isn't that a controversial statement? Again, this is all about what is working best for you. And, as someone who kind of wrote the book, The Carnivore Diet, popularized the name, I didn't invent the name carnivore, but I think I was the first one to attach that phrase with this style of eating. And so I've taken some liberty on how I define that. And so the way I like to define it is, I put this in quotes, a nutritional strategy that focuses on obtaining nutrients from animal sources and either significantly limits or fully eliminates plant foods as needed. And I put the as needed in bold there because that's a critical phrase, to obtain improved health and performance. And so we're looking at what works for you to reach health goals. We're not out there trying to save the tomatoes or save the cucumbers or save the broccoli. This isn't a religious ideology. All we're looking at is human health, and that is the overarching goal for why we do what we do. And I know it goes against what a lot of people believe, what a lot of the nutritional dogma shows, but again, at the end of the day, we are results based. Okay, why does it work? It's all about hormones. It's all about calories in, calories out. Well, quite honestly, none of those statements are true. There's contributions from both of those. Yes, you can get fat or sick eating zero carbohydrates, believe it or not. However, it is difficult for many, and most do not. And why would people get fat or sick? Because they're eating, quite honestly, the wrong amounts of the wrong foods. And those can be fat, protein, and sometimes dairy can be an issue for people. Why does it seem to work? One, satiety. If you don't overeat because you're satiated, that is very helpful. Protein. This tends to be, but not always, and I'll talk about different situations where this is true. It tends to be a higher protein diet than sort of the typical American diet. The typical American diet ranges from about 12 to 16% of its calories coming from protein. Many, if not most people on a carnivore diet are eating 20, 30, even 40% of their calories coming from protein. So protein does seem to have some unique metabolic effects, whether it's the thermic effect of protein, whether it induces greater, NEAT, non-exercise activity thermogenesis. There are some unique aspects of protein. The elimination of garbage food and, the no sugar, no grain, that Vinny is so fond of talking about, the seed oils, et cetera. Clearly we're getting rid of junk food. It's hard to do a junk food meat diet, so that is a big effect. It can be simple, or it is simple. It's a lot of people, it is as simple as, hey, go eat a bunch of meat till you're full and you're done. That helps with compliance. When you're constantly having to calculate macronutrients, when you're constantly having to weigh your food, that gets frustrating over time, and many people have a difficult time adhering to that. So simplicity seems to be another thing. It is non-inflammatory, despite what you might hear from the plant-based camps. What we are seeing consistently is this tends to be an extremely non-inflammatory diet. As we have come to learn that gut health is vital, it has a vital role in our overall health. And this diet also seems to be very, very effective at restoring gut health. All right, I've got a dog that wants to comment on some of these things. All right, so some variations. So which people would benefit from a more strict version of a carnivore diet? And like I said, there's different, I would say, degrees of people that adhere to strictness. Now, people that are dealing with IBD or inflammatory bowel disease, Crohn's disease, ulcerative colitis disease, and I put plus minus IBS in there. IBS is not truly considered an inflammatory bowel disease, but many people with IBS do benefit from going fairly strict. People with severe autoimmune disease, people with refractory mental health disorders, whether it's bipolar, major depressive disorder, anxiety. We've seen things even like post-traumatic stress disorder improve. People that are dealing with severe food addictions, and there are many people that deal with that, people that have binge eating disorder issues. And what does that look like? It's usually some type of ruminant meat. And when I talk about ruminant, I think Peter Ballested either already talked or will talk. You probably learned what a ruminant is. That's an animal with a multi-chambered, I guess, stomach. Cows, goats, sheep, a lot of the wild game would fall into that category. So ruminant meat, salt water, plus or minus organ meats. And this often tends to be on a relatively higher fats situation, 75% or even higher. There's a sort of a more relaxed carnivore diet, and I'll describe what that is below. But people dealing with this kind of run-of-the-mill plain old obesity, diabetes, whether type 1 or type 2, metabolic syndrome, osteoarthritis as opposed to inflammatory arthritis like rheumatoid and psoriatic arthritis, people that are otherwise metabolically healthy, and then generally athletes. And this is red meat, seafood, shellfish, pork, poultry, wild game, eggs, organs, plus or minus dairy. Again, dairy can be problematic for some people, seasoning, spices. And the fat content for this tends to be variable, 50% to 80%, depending on what your goals are. Diabetes. This is an interesting topic. One thing I'll say, if you're a diabetic, the support of your healthcare provider is essential when you're going on a carnivore diet or really any low-carb diet. They may not agree with your dietary choice, but they still are going to need to assist you with medication adjustments. Most diabetics that go on low-carb diets, including carnivore diets, will need to adjust their medications. I should also put that hypertension is another one, and there are a few other medications out there. So if you're on multiple medications, it's probably a good idea to consult with a healthcare provider. If your physician is opposed to it, it might be time to get a new physician. We maintain a huge list of physicians that are low-carb friendly over at meatrx.com if you're looking for one. But regardless, a healthcare provider is helpful. Sulfonylureas, again, diabetics probably know what these are. Caution with sulfonylureas and insulin, as the incidence of hypoglycemia is very possible, particularly early on. Hypoglycemia can be a deadly complication, and so it's not something to ignore. So you have to be very cognizant of the fact, and you need to be able to figure out how to correct hypoglycemia. So usually some sort of dietary intervention that raises blood sugar quickly, whether it's a carbohydrate source, is typically utilized for that. So a lot of people use orange juice or a glucose tablet or something like that. So that's something to realize when you first get on the diet. I believe that there's been some rare cases of DKA, diabetic ketoacidosis, associated with SGLT2 inhibitors with ketogenic diets. I haven't seen that with a carnivore diet yet, but a carnivore diet certainly can be a ketogenic diet. So if you're on those medications, that might be an issue, although it's pretty rare, pretty uncommon. Again, glycemic control appears to be better on the higher fat approach to the carnivore diet, to include quote unquote fat fasts. And in fact, we just had a discussion with our group this morning. A lot of people are doing that. And so that basically, what is a fat fast? That basically means, you only eat fat for a day. And so that is something that people are seeing extremely, extremely tightly controlled glycemic levels with very low blood glucose numbers. Seeing diabetics that typically run 110s, 120s, 130s, 150s are seeing numbers in the 70s and 80s pretty reliably with that approach. So that's something that is emerging as a strategy within that. And there's some literature on very low calorie ketogenic diets showing similar stuff in the literature, which would be consistent with that. Sources of fat that people utilize: beef fat. You can literally go to your butcher, your supermarket, and ask the butcher to save the fat trimmings for you. It often helps if you call ahead. They're almost always more than happy to do it because they just throw it away anyway. And so people are finding that, by taking that, they'll often give you 3, 4, 5, 6, 10 pounds of it. You just cut it up into pieces. You can throw it in a pan, fry it up with some salt, throw it in the air fryer. It is incredibly delicious. It's amazing that they throw this stuff away. If you like bacon, you love this stuff. I mean, it's got that really just fat, salty taste, which is just wonderful. Suet, which is also fat around the internal organs, typically the kidneys. Bone marrow, brain for people that like to eat that, pork belly, egg yolks. Certain sausage is high fat. You want to avoid the stuff that has the garbage in there. And less desirable, quite honestly, are the dairy fats, butter, ghee, cream. Some people can work those in, but generally, I recommend staying more towards the actual true animal fats and not the dairy fats. Protein intake is typically lower for diabetics, and we titrate it to glycemia. So what you want to do is, you titrate up your protein based on your blood sugar. And protein tolerance does seem to improve over time as these diabetics get metabolically healthier. And there's some evidence in the literature, actually there's quite a bit of evidence in the literature, that the beta cells can improve over time. We see that the beta cells, what happens to them, some of them de-differentiate, some of them stop losing insulin secretory capacity, but they're still there. And so type 2 diabetics, in many cases, 60% or more of their beta cells are still active. Even type 1 diabetics have a small amount of living beta cells. And so there's some question is maybe there might be a little bit of recovery there. That's very controversial. I have seen a number of type 1 diabetics that now are on the minimal doses of insulin, and even a few of them that have actually come off insulin, which I know is shocking and controversial, but it is what it is. Now, there's some concern. Ben Bickman and I had this discussion the other day about the fact that he's seeing that as well. And it may be that they're misclassified. Maybe they're really MODY, which is maturity onset diabetes of youth. And that is why we're seeing these type 1 diabetics come off of their insulin completely. So that seems to be a very interesting experience. And again, we often talk about insulin resistance. In fact, that the muscles cannot take up glucose because the insulin-mediated glucose transporter is being inhibited by different compounds, ceramides and things like that. There is there is some evidence that hepatic gluconeogenesis is maybe the primary driver of hyperglycemia rather than the insulin resistance. That is to say, you can still take up skeletal muscles can sorry, dealing with a dog barking there. Skeletal muscle can still uptake glucose despite the insulin resistance. Fasting seems to be very helpful for some of these people. Some people need to do it, some don't. All right, so the metabolically healthy in the athletes, the higher protein approach is often utilized. Fat can be 50 to 80% of the diet at maintenance. It is, and some folks will be able to use some carbohydrates. I often, when I'm dealing with athletes and they want to use carbohydrates, we try to figure out what the minimum effective dose of well-tolerated carbohydrate sources is. That is going to be, and when I say well-tolerated, it's GI tolerability. Does it lead to, issues with recovery, inflammation, those things. Protein in these cases tends to be higher than the RDA, 1.2 to 2.2 grams or more per kilo of body weight is a ballpark estimate. I don't get too prescriptive about this, but I say in general, you have to see what kind of works there. Some will tolerate dairy and rely on that. Dairy can be a source of nutrition that, particularly if weight gain is desired, it has a pretty positive effect on that. Dairy protein is actually a pretty good source of protein, quite honestly. But again, if tolerated. When we're looking at muscle gain, obviously you got to hit your protein goals. Muscle is made out of protein. The literature is quite clear on that carbohydrates are not required for muscle synthesis. What we require for muscle protein synthesis is adequate protein, adequate leucine, which you will undoubtedly get on a meat-based diet. We know that leucine will stimulate something called mTOR, the mammalian target of rapamycin, which is involved in anabolism. The minimum effective dose for that seems to be 2.5 to 3 grams per meal, and we can stimulate that at a frequency of about Q 3 to 4 hours. So every 3 to 4 hours. That is, again, unfortunately, some of that research is based upon whey protein, which is pretty rapidly absorbed. And so I don't know if that 3 to 4 hour and that those numbers hold up on a carnivore diet. But based on what we know on the other research, that's what we're looking at. Post-workout protein, 1 to 2 hours within a workout seems to be helpful. So eating a steak within a couple hours of training, if your goal is to put on muscle. And then the other thing that's important, and this is where carbohydrates can become helpful, is a caloric surplus. As I stated, meat and fat is particularly satiating, and therefore a caloric surplus can be difficult to get into. Some people might require to eat 3, 4, 5, 6 pounds of meat a day, which can be difficult to get you into a sufficient caloric surplus to build muscle. We know that carbohydrates can help to restore glycogen stores, although eating enough protein generally does that as well. And so what we're seeing is you can put on muscle, but it requires effort and work. And then obviously you've got to do the training that goes with that. Fat loss. This is, these are very fun topics for me because it's very controversial, and there's so many people that get sort of wound up about what's the best way to lose fat and so on and so forth. And the answer is there are a number of ways, but within the context of a carnivore diet, I always talk to people when they're dealing with fat loss, particularly if they have food addiction issues. And many people, the reason they gained a lot of weight is because they couldn't stop eating the garbage food. They couldn't stop eating the cookies, the cakes, the pizzas, the food that tends to be a problem, and eating it in, most people can't eat a small amount of this. We know we've got the potato chip commercials that say, you bet you can't just eat one, and they're right, you can't. So you have to deal. The first goal, whenever I'm taking care of clients or discussing this with people, I say, you must deal with the food addiction issues. You've got to figure out how to keep them from relapsing, how to, ending up face down in a bowl of ice cream or on a plate of cupcakes, right? So I think there's a physiologic aspect to that. And then we talked about satiety. There are hormones that are responsive to the nutrition that we eat. Cholecystokinin, it's particularly responsive to protein and fat. That is one of our satiety hormones. It's named because it makes the gallbladder contract, but it's a pretty important satiety hormone. There's mechanical satiety, and so when you stretch your gut out with high fiber, high volume food, and this is why some of the plant-based options that are high volume work, but that often ends up with people with a number of GI difficulties, whether it's just acute things like bloating, gas, pain, constipation, or long-term issues where they develop, IBS. So satiety again is important. So you have to have nutrient sufficiency. It doesn't do you good to eat a high-calorie diet if there's if you're missing some key nutrients. And so an animal-based diet tends to be very high in nutrition, very high in bioavailable nutrients. And then you have to deal with the psychological aspect of this. And so whether you eat for stress, entertainment, boredom, comfort, family pressure, family or peer pressure, the environment that we are in will not change. We're not going to wake up tomorrow and all of a sudden all the junk food is going to disappear from the earth, and the TV commercials imploring you to eat the latest junk food, and your family members trying to tell you eat another bite, eat a bite of their red velvet cake. That's never going to go away. So you have to be able to deal with the psychological aspects of it. And it's much easier when the physiology is in place. You've got to change the relationship with food. And I bold this. I think this is the number one step here. Diets will fail when hunger is constant or food is not tolerated or palatable. Again, if you want a prescription for failing on a diet, tell somebody to be hungry all the time, or tell someone to eat food they don't like. I mean, that's a guaranteed recipe for something that's not going to work. The food needs to be satiating. And I think you need to have some degree of external support for most people, whether it's family, community, coaching. That's some of the stuff that we try to provide at MeatRx for people doing a carnivore-based diet, because a lot of people just don't get support. A lot of times, if you're a meat eater these days, you're almost considered a pariah. You're kind of going the way of the smoker. We're going to start demonizing meat eaters, which hopefully we don't get to. So fat loss approach. So again, the high fat approach, again, this can provide profound satiety and can often be hypocaloric. That is to say, people will get so satiated from eating a very high fat diet that they end up eating a hypocaloric diet. And what does that mean? Well, hypocaloric diet means you're losing weight. Again, I don't want to get too much into the different metabolic advantages, but by definition, if you're losing weight, you are eating less calories than you need to maintain weight. And so you might eat a lot of calories, but you still may be relatively hypocaloric. Nutritional ketosis often results from this. Some will note other added benefits, improved cognition, better mood, etc. This often is a good approach for people that are food addicts, or significantly obese, with the caveat that if it causes satiety, and again, the fat sources are important. I've got pictured here from sort of right to left on my screen, some cut up beef fat that I had talked about, some egg yolks, and that's some Wagyu beef, which is not in everyone's budget, but certainly it's nice if you can get that. Again, if you are eating a bunch of dairy fat and you're throwing stevia in there, so you make some heavy cream and you whip it up, throw a bunch of stevia in there, you're going to be able to overeat much more easily. And so again, if you are a food addict and you're making fat, to the point where you overeat it, then this approach may not work for you. But for most people, it does seem to work pretty well. There's a high protein approach, and I've used all these approaches myself personally. Again, I think you need to be out of that phase of being a food addict. I think if you're dealing with food addiction, then this is not the best approach for you. It works very well for getting very lean athletes, physique competitors. These are often people that need to or want to be at a level of body fat that is, quite honestly, not physiologically normal. These are the people that are quite, quote unquote, shredded or down sub 10% body fat for males and sub 15% body fat for females. The way I approach this and the way I deal with people that want to do that, we work on basically lean meats with periodic high fat refeeds. And these occur about every 3 to 7 days. And the reason for that is, one, fat is critically important for our health in general, but also it helps with compliance, and it helps with, I think, with maintaining metabolic rates. There probably will be, and possibly will be, more hunger to deal with on this approach. You need to time your meals to deal with hunger. As some of you guys are aware, ghrelin is a hormone that stimulates our hunger. It is a hormone that's primarily elicited from our upper GI tract, but there are several locations in our body that secrete ghrelin. Ghrelin tends to peak in a diurnal fashion, with the majority of it occurring later in the day. That's why often people wake up in the morning, they're not hungry, but come evening time, many people are dealing with hunger. And so timing the meals to deal with ghrelin can be helpful. Protein in this case can often be as high as 70%. And believe me, that's hard to do when you're eating a meat-based diet. You have to eat particularly lean cuts of meat, things like fish, shrimp. Those things are important. And I still recommend getting some red meat in the diet on a daily basis. And so you have to go with very lean cuts of red meat when you're doing this. This, in my view, is not a long-term sustainable strategy. This helps for getting down to a certain level of leanness, and then you have to figure out what you're going to do to sustain that. And I've seen that if you can sustain a certain level of leanness for about 6 months, then you kind of almost reach a new set point where you can kind of maintain that a little bit easier. And then the fat refeeds, which I talked about, occurring every 3 to 7 days, are not gorge sessions. It's not an unlicensed day to just eat as much as you possibly can. I did that initially when I was trying that and failed miserably, because I just was eating something like 8,000 calories in fat. And at that time I was including dairy fat. And again, I don't think dairy fat is a particularly good thing to refeed on. I think, again, staying with the other source of fat we talked about is going to work better. But this is where you bring the ribeye steaks back in, and the short ribs, and the skirt steaks, which is delicious, by the way. All right. Some considerations that I've seen in the carnivore community, particularly when it comes to fat loss. Now, and this is, men tend to get results faster. Sorry, ladies. Particularly women that are in that perimenopausal time, it's harder for women, just the way it is. There was a study out there looking at CCK, cholecystokinin, saw that its satiating effect was better on men than women, and then also children in that study. So that may be part of what they do. Most women tend to, in my experience, prefer the higher fat approach. Resistance training. If you're working out, strength training, it seems to be a confounder which may drive you one way or the other. Often people that include more resistance training in their diet do tend to maybe skew more towards a higher protein strategy. Age and digestive function may alter protein availability and needs. And what I mean by that is, as we get older, particularly as we get older, we start to accumulate disease. I think one of those diseases is a decreased function of our digestive tract, and that may be decreased ability to secrete stomach acid, maybe other enzymes other proteases and lipases, and absorptive capacity, just as the digestive tract sorts to get worse as we age. Now, is that a natural consequence of aging, or is that just, an accumulation of disease from eating the wrong diet, poor lifestyle? I think probably more likely than not, it has to do with poor lifestyle over time rather than just flat out age. So we will have to typically most people recommend up your protein as you get older. Okay, what are some of the expectations that I am seeing that I expect to see? And this isn't a comprehensive list, but in general, these tend to be true. We see a decrease in inflammatory markers such as high sensitivity C-reactive protein. We see a decrease in triglycerides. We see decreased glucose and glycemic variability. We see a decrease in blood pressure. We see decreases in visceral fat, including non-alcoholic fatty liver disease. We see increased HDL. We see increases in blood urea, nitrogen, and creatinine, particularly with a high protein approach. And the effect on LDL and total cholesterol is variable. Many people will see significant increases. Some people see no change. Some people will see it actually go down. And some of these was things we'd like to test in our clinical trial just to confirm that. But that is what I'm seeing on a daily sort of basis with frequent feedback from the community. All right, some odds and ends. Cystatin C, I don't know how many folks are healthcare providers in here, but if you're testing someone and you want to assess renal function in carnivores, particularly those on a high protein diet, cystatin C is a far better test than your standard serum creatinine level and the estimated glomerular filtration rate that is based upon that calculation. That is to say, we know that creatinine will often be elevated in people on a high protein diet. And we know that that number is used to calculate the GFR or the glomerular filtration rate. So that can give you a artificially increased creatinine and an artificially decreased GFR confounded by protein intake. So if you look at cystatin C, you will take that confounder out and you'll get a better assessment of what the actual renal function is. And then basically every person that I've seen that's been on a carnivore diet that's been concerned about that, or the doctor's been concerned about that, we send them for cystatin C, and it almost always invariably turns out that shows that they have normal and very good renal function. So gout, I get a lot of questions on gout. Gout may flare up initially, and particularly if you're at risk for gout or you already have gout. And those people that are at risk for gout are the people that are at risk for diabetes, those people that have metabolic syndrome, those people that are, metabolically unhealthy, obese, high levels of visceral fat. You may see a flare up. But generally, as time goes by, as those metabolic issues resolve, systemic inflammation improves, that we see gout go away, despite even elevated levels of uric acid, which may occur. I'll just touch on cancer. I know it's a controversial topic, but we have a number of people that are dealing with cancer, treating cancer, and as we know, many people use ketogenic diets as an adjuvant for cancer treatments. And what I'm seeing is people that are going through cancer treatment with a carnivore diet seem to have much better tolerance to the treatments, whether it's chemotherapy or radiation. They don't seem to get as sick. They don't seem to have some of the profound vomiting and things like that often go with chemotherapy. So that's at least something that can be used as a good part. Does it prevent cancer, improve cancer outcomes? Can't say that yet. I don't think we have any data, particularly in a carnivore diet, that would prove that. Although Dr. Clemens and Dr. Toth in Hungary are doing that research, and so they're getting some data in that regard, particularly with regard to brain tumors. If you've had a previous cholecystectomy or you've had your gallbladder out, it is not a contraindication to this diet. We see that with, again, all kinds of low-carb diets. People without gallbladders Most of the people that lost their gallbladders lost before they went on a low carb diet. In fact, many people would argue that the standard American high carb junk food diet is what's driving the high cholecystectomy rate in the populations. And so you certainly can go on a high fat carnivore diet long term without a gallbladder. Now, that may be some adjustments that you might do. Some people find that adding some digestive supplements early on can be helpful. We do seem to see that the common bile duct, which is left, becomes a reservoir for bile, and you can get a bolus of bile, which is what the gallbladder does. It squeezes when we eat a high-fat meal to secrete bile into the small intestine, which breaks up the fat, emulsifies it like a detergent, so it can be more readily acted upon by digestive enzymes like lipases and then later absorbed. So you can do it with a cholecystectomy. Okay, I think that's all I've got. I'm going to open it up for questions, and I'm going to see if I can figure out how to stop sharing that and see if I'm still there. So
there's a stop sharing button there at the bottom.
Okay, yeah, I see it. Got it.
Yeah.
Now I'm back.
And then if you hit ask a question, that'll pop up the questions in order of interest at the bottom. Yeah.
Okay, so I scroll through these. I don't know what. So okay, I'll just go in order.
At the top, it's the ones with the most interest.
Okay. Joe Rogan said carnivore diet causes aggression and diarrhea, these common side effects. I would say that, aggression, I don't know. I mean, I think some people feel more energized and they want to work out harder. I haven't seen like violent aggression, but I think he's talking about just a desire to use the body in a physical fashion. So I don't know that it's the same as, violent aggression, but I think you just feel like you're just more energized. You want to do things. As far as diarrhea is concerned, it seems to occur in about a quarter of the population that do this. And this is typically, there's a couple things going on. For some people, particularly when they go particularly high fat and they're not used to it, they end up exceeding their absorptive capacity for fat. So they'll get steatorrhea, which is fat in the stool. And that often occurs for a couple of weeks. Some people find that either adjusting the fat down or up in some cases can help with that. What we do know is the colon is presented with a very different situation on a carnivore diet than it is when we're on a high carbohydrate, high fiber diet, because one of the roles of the colon is to absorb fluid and electrolytes. So when we ingest all this fluid and electrolyte, rather than wasting it all, our colon will reabsorb that to save that. And so the minerals are very important. But when we're on a high fiber diet, much of that fluid and electrolyte is trapped within the fiber. So the colon is not faced with that. So when we eliminate the fiber now, the only thing that exits the small intestine is all purely liquid based. And we've known that from looking at patients with ileostomies. They no longer have solid material leaving the small intestine. It's all liquid. So sometimes that level of liquid overwhelms the current capacity of the colon to reabsorb that high fluid, effluents from the small intestine. And so it takes time for that to adapt. So usually this is an adaptation process, but there are some things, maybe too much fat. Some people have issues with eggs. Some people have issues with different cuts of meat. I've seen pork be an issue, high amounts of spice. If you're putting a lot of spicy food, that can just be an irritant to the GI system in the body. It tries to get rid of it quickly. So I would say about 25% of the people that occurs. It tends to be short-lived. People with underlying bowel issues like IBS, this may last for longer just because that's a primary gut issue, which takes longer to heal. Okay, my butcher here in Spain says that fat, especially around the organs, are high in toxins, which he gives me grease whenever I ask for that. Is there merit to this? So I would say that, I think that's a theoretical concern as to how much toxins there are. I mean, certainly in humans, we store things that are fat soluble in our fat. How much that affects an actual human by ingesting it, that is really purely speculative. I have not seen any human data, and the bottom line is there's just not any human trials on this stuff, and this is why it's important to do those human trials. So anybody that's going to say that, it's purely speculation. Typically, when we look at things like even glyphosate, which is that's an active ingredient in Roundup, when we see what actually ends up in animal fat or animal tissues, it is such a minuscule, tiny amount that it is really, really not an issue. And so, eating fat is not an issue in my view, regardless of the animal for the most part. I know it's controversial, but people that are sort of bringing that argument up are basically it's purely speculative. There's no human data that would confirm that. Do we need to do these trials that would test that? Absolutely, I'd agree. But I have not seen, anything that, and again, I'm looking at results in human beings, and that's what I have to go on. So if you feel that that's a concern and you're worried about that, there's probably 1,000 other things that are more concerning in the environment that would be things that I would worry about. All right, what else do we got here? Do people with liver disease need to avoid the carnivore diet? In general, no. It depends on what the liver disease is. If you have, if you're having issues with high levels of ammonia production, then you're going to have to limit your protein content. But for the average person with, and liver disease is a broad category. If I were to, the most common liver disease that we see is non-alcoholic fatty liver disease. And my experience is that this diet generally improves that. Now, the caveat to this is, again, if you are overeating of any diet, in my view, then that can be a problem for your liver. But meat by itself, eaten in a way that provides satiety and doesn't lead to weight gain, is fine for the liver. Okay, what else do we have? I told my optometrist, the cardiologist, and the carnivore, she said he will get cataracts. I don't believe there's any. I don't know of any data that would show that eating a meat diet would cause cataracts. In fact, we have an optometrist cardiologist that has seen the exact opposite occur. Interesting topic. I just had a person in our group this morning said her glaucoma, her eye pressures went from 22 to 17, taking her from basically glaucoma to non-glaucoma. And the optometrist that I've seen has seen improvements in cataracts with the carnivore diet. Is this long-term eating style or to accomplish a goal and wean off eventually? Both. I mean, some people have done it long-term. I've been doing it for 4 years. There's people have been doing it for 20 plus years. Many people use it as a tool, a short-term tool. I think you do, it works. I would tell anybody, if the diet no longer worked for you, you should quit the diet. If it's working for you long-term, and you enjoy it, and you have a good quality of life, then you do it as long as you need to. Just be cognizant of potential issues and monitor for those. But many people use it for a short-term way to solve problems. If we use it as an elimination diet, it works very, very well. It's very effective at helping you solve problems. When we're playing the elimination game, when you have one variable, it's a lot easier than when you have 20 things you're trying to deal with to figure out what's the problem. Are the ultra fat products TSA approved? I don't know. That's not my question. I think that's one for Andy.
Yeah, I would say it's safe to say that they are.
Okay.
It's not a liquid.
Does this way of eating have positive effects on people with thyroid issues getting the numbers within normal range? It can, and it has. I've seen people with things like Hashimoto's, and other types of hypothyroidism significantly improve their clinical symptoms, which is the number one concern, but also see normalization of things, particularly TSA. We do know that low-carb diets, often people will run low levels of T3, which many people think is a normal physiologic adaptation to the low-carb state, just analogous to low insulin. Like we see with a low-carb diet, many people have low insulin relative to what is normal. The normal range of fasting insulin in this country is about 8, whereas a lot of people on low-carb and carnivore diets see their insulin levels drop below 5 and often below 3. And everybody's excited about that because we know we're insulin sensitive. And I think we also see a situation where we become thyroid sensitive. And that's why we may see lower levels of T3 despite normal clinical function. Again, clinical function is at the end of the day what we're all concerned about. Let's see, what else do we have? We have, will the lean approach with a fat refeed days work well for perimenopausal women? It certainly can. And I've seen people that have done that. What else do we have here? As a carnivore, how many grams of protein do you eat on average per day? It depends. I have eaten as much as 600 grams in a day to as little as 100. So it really is. It depends on what I'm doing. So, but on general, as an athlete, I tend to shoot for about 1 gram per pound, but that varies a little bit. What is the most effective way for women to lose body fat in the beginning of menopause? I think, I think there's a lot of things that are going there. I think resistance training is important. I think managing your satiety. I think, again, when I talked about why are we obese in the first place, fixing the food addiction issue has to be the first goal there. I think getting adequate protein and titrating your protein to your activity levels is important. I think protein is an incredibly important macronutrient. But again, satiety is going to be whatever's going to give you satiety. Really, that's going to be it, whether it's high fat or high protein. But including some resistance training in there, I think is probably the general success way. Okay, I think I've got all the questions answered, I suppose.
All right, then I'm going to come back in.
Okay.
And here we are. So listen, thank you so much, Dr. Baker. That was great. Really appreciate it. Hope you had a good time too. Everybody, we will be back in 40 minutes with Dr. Ken Berry. So stick around and come back right before 2:30 Eastern time, which is going to be 11:30 out here on the West Coast.
Perfect. Well, thank you. Thank you, Andy. Apologize. The dog wanted to
No. I love hearing a dog bark.
I don't.
I love dogs. So
all right.
Thank you so much.